The shock West Michigan, 3 children ages 2, 6, and 8 fatally shot by their mother in northern Kent County. Aubrey Ann Moore then used the bolt-action rifle to take her own life. Court records show Moore was hospitalized 5 months ago following a mental health crisis. 13 on your side's John Hogan takes a closer look now at Moore's past and how the mental health system responded.
Investigators say they believe mental illness played a role in the deadly shootings in Solon Township. Now, Moore had been diagnosed with unspecified schizophrenia and paranoia, but was that enough to separate her from her kids? An attorney familiar with the case says not necessarily.
I'll say across the board, this is probably one of the most difficult situations we've ever come across as law enforcement officers.
Murder-suicides are infrequent, to be sure. In Kent County, there has been 4 separate cases involving 8 victims since 2015. The last was nearly 2 years ago. Then came Monday.
The mother is responsible for the death of the 3 children.
After killing her 3 daughters, police say 28-year-old Aubrey Ann Moore turned the rifle on herself.
It appears that mom had a substantial amount of mental health issue.
The Howard City woman in mid-September was apparently hearing voices and seeing things.
Here's the mental illness diagnosed.
Moore said her television warned of a school bus accident involving her kids. She stayed awake believing people would break into her home, and she thought her food was being poisoned. But does it automatically make her a threat to her children?
Absolutely not.
Grand Rapids attorney Charles Clapp has handled hundreds of mental health treatment petitions across the state.
Just because someone has a mental illness does not make them per se an unfit parent. They'd have to show that the children are at risk.
There are no court records indicating that was the case with Moore. She spent 11 days at Forest View Psychiatric Hospital in Grand Rapids Township. Moore was discharged in late September with a 90-day plan that included outpatient treatment. There's no indication that Moore failed to follow through or that she posed a threat to others.
It's a case-by-case basis. Some people could be, but the per se that somebody has a mental illness, it doesn't make them a danger to anyone necessarily. This is a tragic case.
Kent County Prosecutor Chris Becker says a growing number of people who enter the criminal justice system have underlying mental health issues.
We're dealing with it as a community. It's not just a criminal justice thing. It's not just something that, impacts us. It impacts everybody.
Too often, people experiencing an acute mental health crisis wind up either in a hospital emergency room or the county jail. Becker and others are working on an alternative.
We're working at a crisis center. I'm at a crisis center here for Kent County where it gives a way for law enforcement to drop off people, not at the emergency room department and not necessarily in the jail, but something in between where they're kept safe and maybe get the treatment they need.
Monday's murder-suicide, Becker says, again highlights the importance of mental health treatment.
Unfortunately, you have incidents like this that happen. It's a tragedy.
Becker says police and Network 180 leaders are among those working to develop a community crisis center.
Thank you, John.